Perfect.
Oh, good.
And right on cue, we do have a quorum. And we will call the meeting to order. And for the first action item, I need a motion to suspend the rules and allow for members to participate electronically.
So moved.
Thank you. Do I have a second?
Second.
Thank you. Jessica, can you call the roll, please?
Yes. Chair Olds Fry.
Aye.
Thank you. Vice Chair Ohanian.
Aye.
Thank you. Amanda Ngola.
Aye.
Thank you. Ken Rowling
Aye.
and Councilmember Burns.
Aye.
Thank you.
Thank you. And our next item for the agenda is approval of the meeting minutes for March 9th, 2023. Do I have a motion for approval?
So moved.
Thank you. And do I have a second?
I'll second.
Thank you. Jessica, could you please call the roll?
Thank you. Chair Olds Fry.
Aye.
Vice Chair Ohanian.
Aye.
Amanda Ngola.
Aye.
Ken Rowling.
Aye.
And Councilmember Burns.
Aye.
Perfect. Thank you.
And we'll pick up right where we left off, which was our initial public comment period. Again, we will have additional public comment opportunity later in the meeting, but this is our initial public comment offering. Jessica, is there anyone from the public indicating they would like to make comment?
So we have one member attending, but I don't see any hands raised. So no, our attendee is Patrick Keenan Devlin, Executive Director of the Moran Center. Patrick, thank you for coming.
Thank you, Patrick. And with that, we'll go to our first agenda item, which is best practices and assessment measures. And I believe, Jessica, I'm handing it over to you to walk through your memo.
Yes, thank you very much. Also, let me just confirm that we have no virtual public comment, or nobody wrote in. So with that said, let me share my screen. Okay. Can everyone see the screen so far?
We can.
Yes.
Oh, sorry. All right, so we've gone through our agenda and public comment. I'm going to give a brief overview of our best practices and assessment measures. So the case management best practices were lifted generously from the National Association of Social Workers. They've got 10 standards for client systems and case managers, and those standards are summarized in the slide and in the packet. Oops. Okay, and so in Zoom grants, our goal is really to let agencies interested in applying for case management services know how they'll be measured. So we do provide a description in Zoom grants. The 25 questions applicants are asked to complete. Those questions do touch on these standards in terms of enrollment and outreach, a description of the population served, case management practices, caseloads, all of the above. The Zoom grants application also provides space for the budget. And we hope that this is sort of the program budget, but we recognize that in some cases, for some smaller agencies, their total agency budget really is their program budget, but agencies have the option to distinguish or let us know or provide narrative, around the budgets that they're submitting. And then we do ask for additional documentation, including intake and enrollment forms, 990 audits, list of board members, chart of counts. There are many. Okay. So what staff has tried to do in this sort of template summary form is this form would be used for applications as well as reports. And this is a condensed version of, with some slight modifications of hopefully what the committee is used to seeing when we've summarized applications and reports in the past. And this template for case management is open to suggestion and any additions or changes. But we do try to cover all sort of the major topics, including the award, prior year award, and current request. Residents served, both the projected number of residents to be served, but also the number of residents served as the program is running throughout the program year. And then what those services look like, how many service plans are being created, how many referrals or clients being connected to, and the types of referrals, because it's important for us to measure community needs and gaps in services. We also want to keep an eye on agency budgets. Agencies do let us know how they're applying funds, but if they were to lose a major grant or need to shift funds around, we'd want to have a document of that as agencies submit quarterly reports, or they submit reports now 2 times a year. And then we do talk about, any findings on audits if those come up. And as agencies report, staff looks at the financial information agencies provide to show how funds are applied. So this could be staff timesheets and paychecks, time and activity tracker for staff who work with Evanston and non-Evanston residents, mileage and expense reports, supplies if that's needed. We do not pay for overhead, basically. Although agencies are allowed to list those expenses in their budget. And we also don't pay for, we do have a list of things that aren't eligible for grant funds. Excuse me. Are there any questions about this case management services summary form so far? Okay, great. You guys have it in the packet and it's available online, so I can just keep moving unless there are questions. Oops, I apologize. So what we've tried to do to make this a lot of information sort of more streamlined and comparable and more palatable for the committee and for the public is define some key performance indicators and group the Zoom grants scoring questions that members have filled out in the past, or that members have used in the past under these key performance indicators for case management services. And we can talk about those in more detail. The questions under each indicator are also listed in the public services evaluation form, which was attachment C in the packet, but I apologize, it was not labeled that way, but we will get to that. Okay, so we do the same thing for safety net services, although we recognize that safety net services are a little bit less defined. So with case management, we have our standards and we have some key things that we look for. With safety net services, we're really assessing how quickly those services are provided to residents, how they're able to prevent residents from falling into crisis or falling into greater crisis, or how those or those safety net services, excuse me, address a hardship. And our goal is to reach two overlapping populations. Originally, the population served are people who have been hurt by historically racist practices, or who have been historically marginalized. Also with COVID, when this was brought before the Rules Committee and City Council, we added another layer that Safety Net would also help support recovery from the pandemic. We know that our BIPOC residents and people who are like limited English proficiency speakers or recent immigrants, and a lot of the target populations who are historically marginalized, are also most negatively impacted by COVID. So there's a lot of overlap in these populations. Okay, and then we have our Safety Net Services application summary template and report summary template. We're looking at some similarities in terms of the amount of funds requested and the population served, but our differences are, of course, the number of service hours or the number of services provided. And we don't measure agencies based on this, but we do hope to understand, or we do ask agencies to let us know in reports if there are services that participants need to further achieve self-sufficiency, or if there are other services that the safety net service provider connects participants to, whether they're external services or services outside of the agency, or whether they're services that are offered. We think that we call them deeper services. As an example, North Shore Senior Center accepts phone calls from seniors, and they do a lot of benefits enrollment. And that is sort of their main safety net service. But we also know that within North Shore Senior Center, they're able to provide housekeeping services once a month. They connect people to Meals on Wheels or different meal programs. They're able to connect people to caregiver support groups or support groups for seniors to combat depression, and basically like a whole host of deeper services. But really the initial safety net service that city funds support would be the benefits enrollment specialist who spends time either at the Civic Center before COVID or at the Levy Center or out in the community, focused specifically on Evanston residents. So that's just an example of a deeper service that an agency could provide. But if, you know, sometimes people just need food. Sometimes they just need the basic service that they're calling for, which is why we don't want to necessarily penalize agencies, or if agencies provide deeper services, that's great, and we'd love to know about it. But if they don't, and they're providing the service that they agreed to provide in the application, that is also good with us. Okay.
Hey, Jessica, Eric, I have a question for you on this. So I noticed we are, as part of the narrative section, we're inviting agencies to provide information on demographics, population served. Is there a reason why we wouldn't mandate it? Is there a potential concern that they might not be able to collect that information regularly, or might not have it? I guess what's the thinking behind that?
You know, I appreciate that question, because agencies are required, both for safety net and case management, to report demographic and household information. I did not mean in the wording to imply that that was optional.
Okay,
I guess
good.
what I
Okay.
meant was, yeah, if there's a better way to capture that information in a chart form or in a different section, we can do that. But good point. Thank you for bringing that up.
And this is Sam. Oh, sorry, actually, Councilmember Burns.
You could go first. I'm still trying to think through how I want to ask this. So you can go first.
All right, perfect. Thank you. My thought is on the narrative also, and then on a few other things that I think I'm hoping to save till the end, but should we tell or suggest to applicants roughly a paragraph or 2 paragraphs, or, sometime, like, should we give them a target on some of that? Because I could see some organizations doing 3 paragraphs and some doing 3 pages, and that is quite the difference.
Yes, very fair. And thank you for asking. So that's a great point. Agencies don't fill out this information on this form. Staff completes this information and summarizes it, and then presents it to the committee.
Mhm.
So we try to keep it consistent, and we try to keep it pretty streamlined.
I just didn't know if it would be easier for you to just ask the applicants to create a streamlined narrative.
So that's fair. They do, so applicants are limited. Let me see. Applicants. Sorry, so each application question is structured, and there are character limits or format limits to the application questions. And then the reports are also very structured. When agencies are reporting the participants served, service plans, demographic information, household information, special needs, race, ethnicity, I said demographic, and age, those questions they're really just filling in numbers. So it's very straightforward. And then there are narrative questions in the reports that, depending on whether it's case management or safety net, sort of provide space for the agencies to give more information. And from that information, staff extracts either the narrative for the application section or narrative for the report section. Does that answer your question?
Yes.
Jessica, sorry, go ahead.
No. I was gonna go to Councilmember Burns next, but if you had a further elaboration, feel free, Marion.
Yeah, I just wanted to add that I think part of what Jessica is trying to do here is provide a standardized way to give a snapshot of an application in comparison to past performance, have both of those pieces of information together for a committee member to get the basics of what the applicant has provided and how they've performed in the past year all together. I think the narrative spot is especially good for staff to be able to provide any specifics or characteristic that's very applicant based, anything that is slightly different. And it's really like, we don't have a way to standardize it because there's no spot, because it might be slightly different, but that's the spot to call it out essentially, to give a little bit more of a snapshot view of what they've provided in the fairly large amount of information they provide to Jessica every year that not every committee member may fully remember.
No, I find great value in the summary and the framing of this. It was just trying to streamline also Jessica's work in creating that narrative. So thank you. Councilmember Burns?
I'm actually going to hold my comments until the end, but thank you.
Ken?
Thank you. I might have a few questions. Just sort of pulling back from this process and the questions and so forth. I'm wondering, is much of this unique to our I'm going to call it our grant making, our allocation process? Or is this, is this, is the information, the responses to the questions that we ask, is it the same information that applicants can apply, do submit to other funders or to agencies, for contracts, things like that? So I guess the question for me is like, how much of this is unique to I guess it's called the social, these sets of grants that the city awards?
So that's a great question, actually. Some of the information is not unique, although it is specific. There is information, obviously, that's specific to Evanston. I have heard from some agencies that they report very similar information to a lot of their funders and donors, and that it would be helpful. I had a conversation with Books and Breakfast, actually. It would be helpful to, or let me back up and say, I think it would be helpful to agencies to have a deeper conversation to understand more fully what they report to other entities, and we can try to align. But we would not, a lot of the information, like I said, is Evanston specific, and so we wouldn't want to lose any of that information in a more standard.
So a follow-up thought on that is that, so I don't have the applications in front of me where I was able to go through them, but if I recall, a number of the agencies, a good number of them, have large budgets that and they receive, I think, their contracts or their, from government sources, right? Whether they be state or federal programs around housing or mental health care or something. And so I'm just wondering, what is it that is what they propose to those agencies? Is that same information, can they just use for our, in many cases, much smaller grants, right? I think what I'm wandering around about here is like, is there like a common application, a common story, a common, proposal that can be worked out, that goes to each of these varied funders, right? I think there's only a few, for instance, of the grants we made that we were like the prime or the only, the major, if not the only source of money, resources for that agency or for that program. But for most of the agencies, if I recall, they have multiple sources of money, and I would assume they are and which is the name of fundraising. I've been on both sides of this table for 50 years, so I know I know the pain on both sides. Just to throw that in there, but I don't know. It's like, what's the common story then that is that, and the common need, therefore, that we are allocating, $75,000, $50,000, maybe $100,000 toward the work of that agency. So that's kind of what I'm wondering, is where's their, so I wonder, does the community foundation, the Evanston Community Foundation, receive applications from the same? I would suspect that a number of the agencies and organizations that we fund also receive or approach them. Like, is there some coordination? What I want to stay away from is the coordination among funders that I well know of, where a funder can deep six an organization by a negative word or by a negative assessment. On the other hand, I know of how funders talk to each other and help bolster the case of organizations. I just want to make sure there's not that kind of collusion that that I, as a grant seeker, faced a lot. So that's one set of, I'm just, kind of noodling around on that. The other thought I had is that I noticed in the notes, that, well, first of all, you started out with the NASW sort of guidelines, or I'm going to call them assessment of what's the right work, what's the nature of the work for these agencies, and a reference to whether or not agencies are eligible for CDBG, or fall within that. I don't know the right word here, that assessment. And I'm wondering if that's just not a very good starting point for us. And we don't need to put people through quite this many number of questions and explanations for why, for the requests. I'm looking at this in a bit from the applicant side. What makes it easier and more smooth, and yet we retain, we make sure that all of our dollars are going to the neediest, the most vulnerable residents of our community. So.
Yes, could I address, because I think you just became the hero of so many agencies.
That's not my goal, but I know the pain. So.
Yes. Well, and that idea of a common application is an interesting one. And when I'm not reading about best practices in case management, I'm reading about best practices in grant making. So this is kind of up my alley also. I see another memo in my future for this committee. Staff could work with agencies moving forward to assess if we could reach a more common application that would capture the information that the Social Services Committee would like, but also not be as onerous. And I take full blame for the many application questions. I love every single one of them, but it is tedious. I think without having that common application form, the way staff has tried to address that burden on agencies is by moving away from yearly application cycles and moving more toward 2-year or maybe 3 or 5-year application cycles. And that's aspirational and something that I hope that the committee would have the appetite to consider in future meetings, because those best practices are out there and they're interesting, and it would be interesting to explore. So I don't have any definitive answers right now, other than to say, yes, the agencies appreciate your perspective and where you're coming from. There has been talk of a universal application, but it would take many more conversations, because I've only heard about this from 2 or 3 agencies, and it would, but I love it.
Just as a follow, what I'm interested in is helping agencies be able to tell the same story, make the same request, because they are, I hate to talk about it in sort of an impersonal way, but they see the needs in the community. they're the ones in touch with the numbers, I'm gonna, and I don't really like to use this term, but vulnerable communities and vulnerable people. And it's the same people they're talking about, or that they're seeking to serve by needing to go to multiple sources of funds, right? Including individual donors and so forth. And like, how can we help tell that story so they only have to say it once, or have a one presentation sort of that we as one of the funders, that the city as one of the funders responds to. That's kind of where I'm coming from. Yeah. I have one other thought that's maybe more, again, it's pulling back, is it would be so great to have for us to have an overall sense of the needs of this community, right, of Evanston. And we have these amazing set of grantees, I will call them grantees here, who were awarded funds in this last round, right? And they all have the story, a piece of the story, I think. I'm not sure if they're working from one common assessment of unhoused, homeless, people who need mental care, who need assistance in that realm, who need housing, who need food, who need, on and on, and it's to have a sense of how widespread that need is within Evanston. I know I'm talking about a survey or something like that, and that all of the agencies really are working off of. They're together working to address, everything from Meals on Wheels to programs, after school programs for students. So, and I know that that's asking for more data and so forth, but I think it'd be great to allocate $10,000 to some researcher to put together a, the story, the picture of where are most vulnerable people in this community. Anyway, that's I don't want to do any of this with a thought of giving more work to the staff. I'm just sort of looking at what we're trying to do here.
Thank you, Ken.
Yeah.
And I started to type a question, but Jessica, have we ever looked at the hospitals in Evanston, their community needs assessment?
Yes, we have, actually. So we do that every four years for our HUD grants. We put out the community needs assessment plan, and we survey the community. We went through this process in 2019 for our 2020-2024 consolidated plan. And not only did we look at I still have them laying on my desk. Not only did we look at the community needs assessments of the hospitals, but we also partnered with District 65 and 202. Yep, here it is, the community needs assessment from Northwest North Shore. Amita, we partnered with them. We received funding from the city manager's office to work with Cradle to Career, their Evanston advocates who went out in person and went to community events and door to door and through their churches they got like over 500, if I'm remembering, paper and electronic surveys from really a lot of residents who normally would not fill out a city survey that we just post online. So let me take a step back and say the drive to understand gaps in services and what community members need to really thrive is something I'm really passionate about and something that I'm very interested in. And I do think that we've got a lot of great resources, but it is an effort that the city takes on regularly, which is great. And we also don't just do it every 4 years. We do have questions in Zoom grants that we ask agencies to complete around most common referrals and what referrals are most challenging. We ask those questions in the applications, but we also ask them in reports. So for the case management reports, there is a section for case management agencies to indicate how many referrals were made and then what were the most challenging referrals. And there have been many community efforts. There's been a lot of interest around this and a lot of potential partnerships. It would be great to know how agencies are working together, but we do know that they are working together. They've got memorandums of understanding. They do talk about agencies that they're partnering with and referring to. So a lot of that information is out there, but we could always do more. We could always do more.
Very helpful. Thank you so much. I'm going to just triple check Vice Chair Ohanian and Councilmember Burns, your hand is still up. I'm not sure if that was just from before or not, but I want to circle back just to make sure I don't miss you. If it is for now.
Yeah, I was just gonna, if there's still more to the presentation, I'll hold my questions until the end.
I do think there's a little bit more, right, Jessica?
Yes, can I also add, because Ali Harned very helpfully typed in the question and answer, she brought up the city's e-plan, which I do work very closely with Christine Myers. She presented to the Social Services Committee about those results, and the Mental Health Task Force does have a gaps in assets analysis, and we would like to invite them back and hear what they know about gaps in services or services that people are challenged to connect with. That's part of what I think helped the committee decide to apply support services to mental health funds. So thank you for letting me add that. But going back to our safety net summary, or the application and report summary, we are looking at.
Sorry,
We've
Jessica,
got one more question. I'm so sorry. Derek, go right ahead, or Vice Chair Ohanian, please.
Thank you, Chair. Yeah, I was just gonna say, I really like Ken's allusion to essentially a state of the union, right? It's like a state of the union of what we need in terms of case management, safety, social safety net services, what the needs are. And it sounds like a pretty onerous, expensive process to get that consistently year over year. And I'm not saying that we should put that aside from like a central city of Evanston point perspective, or working with other agencies like Ali referenced in the those reports in her comment. But I wonder if there's also a worthwhileness to, even in our applications, you know, thinking about college application essays and where there's just sort of broad general questions to the applicant of like, what do you think the state of needs are in the city of Evanston today and why? Maybe just starting to glean some of those responses and understand some trends and analyses there from agency responses could be worthwhile too, and it could be a low cost way to achieve that.
Mhm.
That's all I had.
Thank you. No, you know what? I second that. I absolutely agree. One of the benefits, I think, to come out of COVID was more virtual meetings, more roundtables, and more discussion from city staff, with agencies, with community partners. And that is definitely something that I think we look forward to carrying over. as we go. And this is why this conversation is so great and so needed, because I do think that there's a way to incorporate that information or incorporate the asking of that information in our applications and in reports. And so I would love that feedback from the committee as we review our documents. So, okay, so our safety net assessment, key performance indicators are similar to case management in terms of, target populations and the safety net services provided, the cost reasonableness of their budget and performance. The way we get to those indicators is through the questions in Zoom grants. And so in the public services evaluation for safety net, you see the Zoom grants questions. And now these are the Zoom grants score questions, not the application questions. But the next level, I think, of analysis is to list the questions that provide this information. Those questions are, as we look at the Zoom grant score questions, each score question indicates the application question that corresponds to it. So the hope is that all of this information is connected and accessible. Then there are also administrative sort of assessments or key performance indicators from an administrative point of view. In the past, staff has completed this section in the Zoom grant score tool. And it's the same for both case management and safety net, because it is not staff's role to assess the services themselves, but it is staff's role to assess program reporting, cost reasonableness, how the program is being administered, and what sort of how city funds how city funds provide the capacity for the agency to deliver services, whether it's, again, case management or safety net. And case management is unique in that because the definition of case management services is the same for all case management providers, staff can provide more cost analysis in terms of how much of the agency budget is going toward supporting Evanston residents, what it looks like almost on a cost per person served basis. Staff has been asked to evaluate services in that way in the past. Staff has been hesitant under our old allocation model because, as I'm sure you guys can see, we were kind of comparing apples and oranges, right? But with case management services, there is that similarity of services. It would not work for safety net necessarily. So that's my 2 cents. And then while I said that it's not staff's role to review the programs, it is staff's role to review if the applicant is delivering services in the way that the applicant agreed to in the application. So I do want to make that distinction, but it, yes, so I will leave it there. Are there any questions about, I'm sorry, the administrative assessment or any of the key performance indicators?
Well, I think this was very helpful, Jessica. And I would say it's almost like it's staff's role to share your assessment of compliance and integrity to the application and the grant that the applicant was awarded. So that is very much helpful and needed. I also think from an application perspective, I don't have so much, at least at the moment, thoughts on like the questions or sort of standardizing them, and sort of adding more, simplifying that process. I think that makes perfect sense. What I also think would be helpful, I hope, from an applicant perspective, is sort of indicating what we are assessing or what our expectations are. Like, I do know we told agencies in the budget component of the application that it should be the program budget. And there was confusion last time because agencies maybe didn't submit their program budget and submitted their whole budget. And so the funding of the grant looked like it was 2% of the program versus 30% of the program. And perhaps how this committee took that was maybe different than how it was in the past, where we thought, okay, if we're only 2% of their funding for an entire program, then a reduction is not going to impact services as much as it would if it's 30% or 50% or 80%. And I understand, although I wasn't in the previous committees, that's really different than how the last committees sort of took that approach. And so I think for areas where we know what our, I'm going to just call it our scoring metric, but not necessarily like that, but just sort of our priorities, or we are going to be comparing you, I'm just going to use the NASW best practices. We are, that is our expectation, and that's what we're going to be comparing you against. I think it would be helpful both for committee members, but then also for applicants, for us to be really transparent of this is what we've asked for, and this is, how, what we believe is a successful model or best practices. And in some ways, I think the application questions made that really clear. Like, I remember seeing stuff around, focus on, I apologize, my brain is not clearly there today, but anyhow, I know we've done that to some extent in past applications. Like I think it was for support services where we talked about, proximity to public transportation and some of those other things, like these are the priorities of the committee. I think where we can make that and document it either within the application or very close to the application, so that should we have folks confused later or not sure, or whatever, we can really point to that documentation, and that applicants in the meantime, as they are applying, know what we're looking for as well.
Yeah, I have to say I couldn't agree more. And with case management applications, with case management services, as you pointed out, it is a little bit easier because there is more standardization. But safety net services really benefit from more definition and more transparency. And to your point, even in case management, we have a little bit of a disconnect in the city's message to applicants in terms of capacity. So in applications, there is this section where we ask about the number of unduplicated people served in the prior year, and then the number of unduplicated people served in the anticipated to be served in the, or projected to be served in the upcoming year. And I say that like it's just two questions, but it's really not. We ask for like low mod and how many of them are Evanston residents and how many is the total population and what, and agencies, I think, feel the need to point out like, well, if we served 100 people in this prior year, we'll serve 150 in the upcoming year to show capacity. But that is challenging for the agencies, and we're asking the city is asking the question in a way that is a little bit not accurate. What we mean to ask is, we know people are going to cycle out of case management services. And we're just wondering if they're cycling out at a rate of like yearly or 2 years. So if 10 people exit the program, is the program roughly able to serve, 10 more Evanston residents? Or do we find that, the agency has the capacity to serve more, but maybe, they're seeing an influx of people from Skokie or other communities, which is absolutely fine. We're just trying to understand what the capacity looks like. And we have not done a good job of defining it, that question to agencies applying. But I'm open to suggestion and we're working on it. And if that's just one example, Cheryl's Bride, that speaks to your point about the need for more definition and transparency in case management services, there are more examples in terms of safety net services, which, as we've said, is a little bit more ambiguous. And we don't mean to be ambiguous. I do see the committee having further discussions about priorities and community need as we put more definition around our application and assessment process. Yeah.
That was very helpful. And it's almost like you're asking average duration of member enrollment in the program. And you might be able to like calculate it.
Oh, yeah. Oh, we definitely are able to calculate it now. Moving forward, we weren't under our old system for different reasons that had to do with HUD compliance and reporting. That's
And Councilmember Burns, I believe this is the last slide for this part of the presentation. Is that right, Jessica?
yeah. So next I sort of talk about the evaluation tools available. But in terms of looking at key performance indicators or the way we're assessing, that is, my summation is done. If we want to now talk about changes, additions, I'm open to that.
Yeah, I can jump in here. So the first thing I wanted to talk about, which I think may speak a little bit to a point Kim made earlier. I'm trying to quickly find it in my email because I wanted to forward it to the chair and also to Jessica. But I think having a snapshot either on individual agencies, which may be kind of time consuming and difficult to achieve, but at the very least, maybe combining information from all the agencies would be helpful. Cheryl will try, and Jessica, I sent you one that we received from Trilogy, who provides kind of on-demand first response to alternative crisis in Evanston, but also in surrounding communities, including Chicago, I think Skokie. And in the snapshot, they talk about calls received. They talked about unduplicated clients served, how many initial crisis mobilizations, how many follow-up appointments. They break down kind of the reason for the call, which I think for what we're talking about could apply to not only why people kind of initially sought services, but also where are we referring, where our agencies referring people out to other third-party agencies, or, what categories are we finding most people that leads to most people on waiting lists. There's a number of, or different services that are being requested that aren't offered. So there's a bunch of different ways we can present that. But in the trilogy kind of report, or snapshot report, it breaks it down: reason for call, aggression, anxiety, domestic violence, wellness check, etc. It talks about referral source, and then the area in which the service calls came from. So I think it would be helpful to find some way to present all of this information in a snapshot for the committee, so that we can understand what all of it means, and what are some kind of key areas that we should pay attention to and take notice of that may help inform future decisions somehow. So that was a thought that came from something Ken said. I haven't fully thought it out, but I could bring it up between meetings. I'll have other thoughts about it, but I just wanted to pass that along as a reference. And then if you can share that to the rest of the members as well, for whatever reason, everybody didn't pop up in my email. I think the second thought is, it's so also one, I think it probably would be helpful, and I think it's something that we can achieve to cut down on the amount of questions. So I agree with that wholeheartedly. I think with some collaboration with the agencies, we should be able to achieve that. I think my primary questions comes from, it seems like we're collecting a lot of information from agencies, but I'm not seeing where I'm not clear right now on how we're tracking the quality of what people are providing. And along with that, if we're basing future funding decisions on the quality of what people are submitting, whether that's, I talked about this in the last meeting, like service plans. It seems like we're checking a box saying, okay, they submitted a service plan, but are there some key features in a service plan that we as a city say every service plan should have this, right? And one of the things that I think about with case management that always pops in my head is, I think a really important key feature in every service plan for case management in particular might be like network. Like, you came in, maybe you didn't have the strongest network, but one of the things we want to make sure is that somebody has kind of a network and a support system, within a certain amount of time. And that's something that's really important that we want people to achieve. But I'm trying to get a better sense of if we're holding people accountable to a certain quality of services provided that we don't have to come up with ourselves. I'm sure there's some, organization that can help us understand what that looks like in different areas, whether it's the ratio of kind of case managers to caseload or whatever it is, but trying to get more into the quality of services being provided. And I think the other thing is, it's not clear to me what we require for an agency to be eligible for funding, other than maybe you need to reach a certain score, which that's not clear either. So that's another question. It's just, in order for somebody to get funded, do they need to reach a certain score? But outside of that, it seems like the two things we focus on for an agency to be eligible for funding comes down to they need to serve kind of low and moderate income clients. And I think there was a mention of kind of prioritizing vulnerable and marginalized communities. And it's not clear if any of these other things are requirements, such as, let me find it in my notes. Agency has a system for receiving client feedback, as an example. Like, to me, that should be something we require from agencies, and not necessarily go towards a point system, but we should just say, look, the standard of receiving funding from the city of Evanston requires not only that you target lower income and marginalized groups, but also the set of other criteria, whatever they are. So I think that's kind of where I'm at. And I could kind of break it down in each. I have a bunch of notes on how we could do this in each category, which I don't think this is the right venue to get into, but I think overall that's where my train of thought is right now.
I really like that. And I just couldn't agree more, council member, that as our grantees have been, and especially as we start to look if we look to longer term grants, outcomes are really critical. And it's one thing to put together a really good grant application that it scores well, and it's another to put together a really good program that drives the outcomes that we're hoping for. And so how do we make sure we're both monitoring and then actually capturing that, and then in a way that's not so burdensome, right? Like there's this balance, but it's critical. So I think those are all really great comments. And this visual, I'm really excited that you shared this. It's really quite nice from a just visual perspective, the trilogy document that Jessica will share. And with that, I want to note it is 8:10. We have more of this presentation, and then we have more like of the assessments, and then we have the what did we call them? The third party. Oh goodness, I lost the other word for it. Sorry. We have another presentation, so I just want to take a note of time. But Ken, I think you had a comment.
No, I'll pass at this point. Yeah.
Perfect. We'll keep on going, Jessica.
Okay, thanks so much. So this is really exciting. Councilmember Burns, I appreciate all of your comments and taking notes, and I look forward to future discussions. But you were leading me right into sort of the next section of my presentation, which is options for the committee to assess the good work that agencies are doing. I've mentioned the Zoom Grants tool, the Zoom Grant score tool, and those questions are provided in the application. We also have included in the packet, I'm sorry, I said the Zoom Grants score questions were provided in the application. What I meant to say was the Zoom Grants score questions that committee members fill out to assess applicants. Those questions are listed in the packet under attachment A. So just to clarify, you have the questions that agencies fill out, and then you've got the questions that committee members, excuse me, have filled out in the past to assess the work that agencies have done. And then we also, I'm just gonna, let's see, in the public services attachment, the Zoom Grants sort of score questions are listed under those key performance indicators. So Councilmember Burns, to your point specifically, our application does ask agencies if they have a system for receiving client feedback, and that the how agencies respond to that is under the best practices KPI for case management. And one of our additional options for assessing applications is possibly weighing the different criteria or weighing our key performance indicators. So I mentioned the Zoom Grants score tool. We've got those public services evaluation sheets. Those are structured similarly to the ARPA score sheets. So in one column, they list the key performance indicator for each. In the next column, it indicates or it lists the questions and criteria that used to assess agencies. And then we can also include sort of descriptions should the committee want to move forward with this
Jessica,
evaluation sheet.
are you planning on sharing your screen and sharing that sheet that you worked on?
I certainly I could. Okay.
So I think it's helpful to be able to visually link, like what you've done with that sheet is it's helpful to be able to visually link all the different pieces that you've been talking about. Because that tool is categorizing the scoring question that were existing under those KPIs so that committee members can really understand how those existing questions were organized and what they were addressing, which I think was one of the question that came up. What are we really truly looking at? Because it is in some cases a long list, so it helps kind of structure.
Thank you for that. Yes. Okay, everybody hold your breath and cross your fingers that I can share this in my screen. Let's see. I have a crazy system here where I've got several screens all at once. Okay, great. So what Marion mentioned and what we're looking at now, like I said, it is included in the packet for meeting attendees, should you also want to review this information. But this one is for the case management services. So under our key performance indicator, for example, we're looking at services to target populations, and we have the option to assess those services based on the Zoom Grants score feature questions, which include, enrollment process, which does draw from a wide referral network that reaches people. How city funds would expand capacity to serve New Evanston residents, program services targeted the demographic we're looking for or our key population, and that program addresses the city equity goal is demonstrated by a strategy to expand services to residents who experience barriers. So this is specifically like residents disengaged from government, our low LEP, our limited English proficiency residents, or residents who may be new to the community. The Zoom grant score questions are also listed under our case management best practices. So in these questions, we're assessing like caseload comes up. We know that for best practices, caseloads shouldn't really exceed 20, maybe maximum 25. And we also know that for people who are involved in sort of long-term services, there can be people who have just enrolled and might need many sessions. And then there are people who are established and may need fewer meetings. So in that case, it might be that case managers carry a little bit of a heavier load if, let's say, 10 of the people that they're working with are really high need, recently in crisis, but that, let's say, 10 others are well into their service plans, and maybe they've got 10 more who have all but completed service plans, are, really have the good established connections in the community and connections to additional community services. Perhaps those participants don't need as much intervention, but that is the only time when we're looking at a caseload that's larger than like 20 to 25. We also look at the type of case management, like the case management methodology. So are agencies using trauma-informed care? Are they using strength-based interviewing as an example? So agencies have, the chance to answer those questions in the application. I think what I want to step back and really say is, if after reviewing these questions and criteria, if there are things that maybe we're not considering, or that the committee would like to consider in more detail, I can also scroll down, and we have here the administrative review section. And then in light gray, sort of a basic eligibility. Anyone who completes an application, because we do have an open application process. So technically any agency could fill out an application, which would need to be introduced in a public meeting. But this would give staff the ability to immediately sort of determine if an agency doesn't, like Ravinia is a nonprofit, right? But we know that, Ravinia would not, if Ravinia requested funds, they wouldn't meet any of our income or service eligibility. So we would be required to disclose that Ravinia applied for city funds, but we could say, you're not eligible. So that was a maybe over the top example, but it does highlight that this tool gives us the opportunity to rule out applications if need be. The second evaluation form for public services has the similar structure. So we have our key performance indicators, and then we do identify the Zoom Grants score questions that fall under those key performance indicators, and a description of why, how that the score questions fit with the indicator identified. And then, like I said, there is also that administrative section that is the same for both. So what I would really want to focus on would be the questions, the Zoom Grants questions, and should the committee want, maybe the descriptors, because I think that we will see that based on the descriptors, we're actually capturing the information that the committee wants to see, and that using this tool, there is room to then score or weight or assess these agencies and the services. Are there, should I keep this sheet up, or let me pause here, I guess, and see if there are any questions.
Councilmember Burns, your hand is up. I don't know.
Yeah, and if you wouldn't mind, that sheet was helpful. If you wouldn't mind sharing that again, and then going closer to the top of it around, I think it was case management and caseload. And while you're pulling that up, I guess my first question is, right now we're using that criteria to score agencies, correct?
We have the option to use the tool in the past funding round. Yes, we have the option, and it has been used in the past. Mm-hmm.
But the last we didn't use it in the last round of funding.
Correct.
The scoring. Okay. So when we've scored in the past, each section was weighted at that point, right? It would almost need to be in order to provide a score, or explain to me kind of how the scoring works alongside weighting each criteria.
Sorry. Okay. I made it a little bit bigger, so hopefully it's a little bit easier to see. Is it still up on my screen? Or are you guys still able to
Yeah, we can see it. Yep.
Oh, great. Okay.
Yep.
So the way we could weight is by assigning maybe a point system to the Zoom grants questions, or assigning a performance standard, either meets or does not meet, or is exceptional or standard or inconsistent. I believe the committee talked about sort of a red, yellow, and green light, or green, yellow, red light. And so that's where that exceptional, standard, or inconsistent and incomplete measure would come in. Or each question could be assigned a point and or a value, and then depending on how committee members sort of use the evaluation sheet to review services, we could then give certain key performance indicators more, certain key performance indicators or questions would be worth more points than others. And this is absolutely something, should the committee be interested in going this route, this is something that we would have to test and sort of look at with more depth. What I really wanted to get across in this meeting is the ways we have evaluated applicants and reports in the past to make sure we're really capturing the information that the committee wants to see, or to explain why we're capturing the information we're capturing. And if the committee agrees on the information that we're capturing, and that, you know, that information is valid, then I think we're able to move into sort of the next phase, which would be, again, weighting questions or reviewing performance standards.
And how did we do that before, when we did kind of weight the different questions and use the criteria to score agencies? How was it done before?
Oh, sure. So in Zoom grants, all of the questions had sort of like a 1 through 5. Committee members would kind of score them 1 through 5. And this was a challenge and something that mental health board members were looking into, you know, even with that past practice, what constituted a 5 or a 4 or a 3 or a 1. But basically, each question was scored by each committee member. And then staff compiled sort of the average for each question, and then an average score for each application. And those scores were then used by either a working group or the board as a whole to determine allocations. As an example, agencies that scored, you know, 90% or above would receive, you know, 100% of their funding request. Agencies that scored, you know, 75 to 90 would get, you know, 80% of their requests, depending on the ask and how much was available and how those numbers kind of broke down. And so the Social Services Committee could, you know, look at scoring each question. The Zoom grants tool is, I think, really, really nice. I could pull it up, but for each, there's a split screen in Zoom grants where you have the scores, the questions that the committee members would be answering. And then you've got the application on the other side. So when we say in the score questions, I'm just going to use safety net because that's what I have in front of me as an example. Services are clearly described and measurable. Connection between services and stabilization of households is evident. So that is an example of a safety net score question. That question also has in brackets Q1 and Q2, meaning someone who is trying to answer that question could look at the first and second, the answers to the first and second application questions to see how agencies answered those questions. And then based on the agency's answers could decide, yes, I think this application does an excellent job of describing it, a measurable connection between services and stabilization of households. I will give them a 5. Or the way the service provided maybe conditionally stabilizes people or stabilizes, how a person in a certain area, but not others. They still have other needs. So maybe I'll give that, a 3. Again, recognizing that one agency providing safety net services cannot provide sort of all of the services. It's just a question of, if the agency's goal is to provide services to domestic people fleeing domestic violence, like, are they doing that? It's not, are they doing that and providing housing and providing food and providing, enrollments, benefits enrollment. I'm going to pause there because I tend to ramble on a little bit, but I hope I'm making clear the connections between the application questions and the Zoom grants score questions. And also we did not have a way of ranking or weighing, specific questions. They all kind of had the same, it's either 1 through 5. And we didn't weight by category, which is what the key performance indicators sort of pulls out and describes.
Yeah, that's helpful. And then where is it at again? You mentioned around caseload. I think you said 20% that came up, but could you just quickly explain what you're looking for in terms of caseload, what some of the standards are around, what the ratio should look like between, caseworkers and caseload. You talked about it briefly earlier. I just forgot what those numbers were.
Sure, that is a very fair question. According to the NASW standards, let me pull it up. The idea is that caseloads should be reasonable. Oh, here it is, standard 9. Sorry, now I've got to scroll down to standard 9.
And did we were those standards in our packet by any chance? Because I don't know if I saw them.
There was a hyperlink in the memo that
I missed that, sorry. Okay.
Yeah, but standard 9 reads, the social work case manager should carry a reasonable caseload that allows the case manager to effectively plan, provide, and evaluate case management tasks related to client and systems intervention. So I will just share from my own background, because I came from a case management background, that it is difficult to put a set number on it. But a active caseload of 10 to 15, and Amanda, please weigh in, or any, I wish Cherie were here to weigh in, but if you're working with participants and you're providing holistic case management services, meaning you are working with participants who are maybe coming from a background of homelessness or chronic homelessness, incarceration and recent reentry into society, or who have spent a number of years perhaps wrestling with substance use issues. These clients tend to be incredibly vulnerable, as you guys know, and need not just, food or shelter, but also enrollment in SNAP benefits or any sort of benefits that they can find, help obtaining probably state ID, birth certificate, identification documents. They need housing, they need transportation, they need job help support, they need sort of everything. And when a case manager is working with a participant with these deep needs, you could be meeting with that participant for an hour or two, 3 or 4 days a week, easily, to help that individual start to stabilize. And to your point, Councilmember Burns, connect with other community supports that are available. No case manager could have 20 participants like that. You can maybe have 5 or 7 because you are doing so much outreach and engagement and intense work. They take up a lot of time. However, participants who have been working with a holistic case management program, perhaps for 6 months to a year or a year and a half, you would expect that those participants are more stable and need less frequent connection. Those participants are probably only meeting with their case manager weekly or monthly, just to check in, just to make sure there haven't been any crises that have threatened their stability. So a case manager could have, 5 intense participants, 10 who are maybe 6 months into their service plan, 8 months, 9 months or a year into their service plan. And then maybe again, like 10 to 15 participants who are a year and a half, 2 years out of the program, who are stable, but just, need the check-in, need the occasional touch point just to make sure they're still thriving. That is why there is no hard and fast rule. But when I'm reading applications, when I think committee members are reading applications and thinking about the populations that these agencies are working with and the depth of service that they need, if in that question about case management size, agencies are responding that they're working with 25, 30 participants, you would anticipate that either a portion of those participants are farther along in their plan and will hopefully successfully exit the program or graduate from their service plan, which would free up the ability to take on 1 or 2 more participants who need more regular contact under that holistic model, because people are always kind of moving through the program. So when agencies answer that sort of challenging question, I'm looking at question 6 on page 10 of the packet about, completing the chart of the unduplicated number of people served and then to be served. The thought is that there are people graduating, which does free up more room for people to enroll in services, but that the number of participants in services at any given time stays about the same.
Yeah, and I'll be quick kind of with this next portion. So, but I think it is important to have standards for a few reasons. I think one, I think it allows us to apply, different to evaluate and apply different criteria fairly across different agencies, which hopefully will make it easier for us to determine, if someone is funded or perhaps even the level that they're funded. And I know the last go around, we heard from agencies who are concerned about how the committee was determining funding amounts between different agencies. And while I think some standards are hard to set than others, you've just described one. I think if we spend enough time, we can find a way to develop those standards. And if we're using a point system, it doesn't mean that you're ruled out if you don't meet that standard, but you get higher scores the closer you are to that standard. So I think there's a way to do it where it doesn't rule agencies out, but it helps us have a fair and transparent evaluation process. And for me, I think what I would appreciate seeing under key performance indicators are those standards. So for me in that column, I would love to see for caseload as an example, here's our standard. It's, you shouldn't have one caseworker, should have roughly about this much caseload, and we can define that by the amount of total hours that are spent with clients. We can define that by the frequency of visits. I mean, we can think about the way to do that, but I think that's what I would appreciate seeing in the column of key performance indicators. To give another example, I think under service plans, again, what is that outcome that we're trying to achieve? So how many, again, doesn't rule you out if you don't meet this standard. It just means the closer you are to it, the more points you receive. But how many people do we want graduating from service plans? And again, within those service plans, we don't have to dictate like every detail, but within those service plans, what are some key features that we're looking for? So again, I could go on and on in this. I think we probably need, I don't know the right venue to do what we're doing now, because I think this is an important exercise. It's going to take a lot of conversation to fine tune, but I think overall, that's personally what I'm looking for is under key performance indicators, having some really clear standards for organizations to meet, and gearing it towards the quality that we're looking for, the outcome that we're looking for. And again, just to close, I think it'll help us guarantee more fairness and an evenly applied system of determining funding and funding levels, which will hopefully then also lead to better outcomes overall in our community. So, but thank you, Jessica, for going over that.
Thank you so much. Thank you so much for your comments. I appreciate them. And I agree. It's critically important. So what would the committee, if we were to have a deeper discussion about those key performance indicators to make sure that we're really capturing what the committee would like to see, and that they tie in with the questions, not only that we're asking agencies, but the questions then we're asking ourselves as we review agency services. Could we use this attachment C, this case management service evaluation and safety net service evaluation? Could we use these sheets as the foundation of the conversation, and maybe like have a working group offer suggestions and go, or would you? That's what I would put to the committee. What how can staff best move forward?
Yeah.
Or what is
Mhm.
this evaluation sheet maybe not capturing that we want to capture, or how could we present it in a way that's a little bit more clear?
So Chair, I can offer a suggestion.
That would be great.
I know we, in kind of lieu of a working group, we decided to have the discussion with the full committee, which I think was the right call and helpful. But I think we may need to ultimately go down the working group path. And I think what would make those sessions more effective is if we can find some evaluation processes that feature some of the things that we've heard today. And I know Ken and I have probably taken up most of the time, but maybe in between the meeting, people can provide any additional comments as to what they would like to see included. And then we can try to find places that are doing similar things in their evaluation processes. I think it's always easier to start off with something that's already complete as opposed to having to try to do it from scratch. Where we need to, we can develop a new way of doing things, but I think where possible, I think it would be much easier if we can find something that's close to what we're looking for. But I do think we probably need to forward this to a kind of working group where we can probably be easier in person, can meet and kind of noodle through all these details.
Marion?
Yeah, I was just going to suggest as well that if we're trying to kind of add those standards and that piece of information to the evaluation sheet, that we think about this tool in association with the summary sheet that Jessica presented earlier in the meeting, whether it's in that shape or in the shape of something slightly different or existing or anything like that. But just so that all that information kind of carries through the whole process. And then when committee members or the public is looking to understand what you're evaluating on and what that data looks like for the application, that it's summarized in 2 spots, but not really no more than that, to give that kind of snapshot.
I agree, Marion, and I agree, Councilmember Burns, that this level of detail and further review probably does need a working group.
And I guess the only last thing I wanted to say is that ultimately, I think it would be great if, I think it would be difficult to go back to what it sounds like was done before, where individual committee members kind of went in and submitted scores. Hopefully we can get this to a point where it's very clear what we're looking for. And so staff can continue to, evaluate the responses from agencies, provide, I think, information that would help us then have the discussion when the funding requests get to committee. So I think it's just important, at least from my perspective. Hopefully this will simplify things, and so it won't require more participation from committee members, but a little less, and probably, hopefully, the same amount of staff time, if not less, is the goal.
Like those goals. Ken?
A couple things. Can this committee, can we establish a working group? Is it, and do we violate the Open Meetings Act, or would the working group need to be an open, announced and then be an open meeting? I'm not sure what's permissible under our under our open meetings commitment. And the second thought I have, it's more of a thought. I'm wondering if NSAW, NASW has, standard kind of evaluation processes or formats or something that could be, or maybe this is it. But I liked your suggestion, Bobby, that we Councilmember Burns, that we start with some template or some format, some recommendation, and not try to cook it up just from scratch.
So as far as the working group, as long as there's only 2 committee members, then you can have a working group.
Oh,
Yeah, I tried to reduce the number of meetings to be cognizant of Jessica's time, but I do agree that maybe in this case that might be helpful to have even a couple sessions to just kind of iron out certain things and make sure that she's able to move forward.
And I just want to quickly speak to that. Again, I'm happy to, I may have the most interest in this, so I'm happy to participate in the working group. I will say if it's more than 2, that, I know we are trying to cut down on the amount of, meetings we have to notice and do minutes. It creates additional work, which I'm sensitive to, but I think this would be a discussion where I think we probably could have less sessions, the more people that volunteer to kind of lend their input from this committee. And ultimately, even if we have to notice a meeting or 2, the hope is that we don't have, this is the last, we don't have to do this on a regular basis, that we visit it now and we won't have to revisit it again for quite some time. So I just wanted to add those points.
Yeah, and if we have to notice the meeting or make it a public meeting, then I think it would be ideal for just simply using the social service committee to be having those conversations. Because we would.
Yeah, the only thing I just think that, we could, I guess it just depends on what other agenda items we have. And if, we could meet, the working group could meet before the next meeting so that we have actions to take at that meeting and don't have to take up more time with this issue, especially if we need to put our attention to other issues. But I'm open to either one. I think the value of an additional meeting is that we can meet prior to the next social services committee meeting.
I agree, Councilmember Burns, just the idea of being able to sort of move forward and make progress in this. I do think both Ken and you indicated an interest in that working group. Are there others that have an interest in it? Or would you be happy to have Ken and Councilmember Burns bring it back to the full committee? Which everything comes back to the full committee. So
Yeah.
I just want to be clear on that too.
I actually wasn't volunteering yet.
Okay, perfect.
Yeah, because I would be interested in people with more knowledge or more background in this kind. I do not have much knowledge or background in case management issues and all of that. And I just, if anybody else on the committee has some of that experience or interest, I would gladly step aside and have somebody else do it. So.
And I do think having the right participation is important. And so if the only way to get that participation is to discuss it during a regular social services committee meeting, then I would personally prefer that over not having that kind of expertise in the meetings, because I have a lot of ideas, but also not the background. So
I think
yeah.
I have some background as well, but I'm not actually volunteering only because I'm not opposed to standards and things, but I actually kind of like having the full description and having some of the nuances that we can kind of assess, but I think if a work group comes up with some great ideas, like, so I don't know if I'm the right person for the committee necessarily, but it felt like I should say something because maybe I've been indicated as somebody who has some expertise, but I prefer to sit back on this one.
Hmm.
I also think it's important to note, because I had a feeling that people may have interpreted some of my suggestions as us moving towards something that's too rigid and can't account for some of the nuances. And I think I'm looking for I think I'm looking for both, like nuance where appropriate, but also some standards where appropriate, and trying to see if there's a way to incorporate a bit more standards. Well, because in some sense we already are incorporating standards. They're just, as far as I can tell, not we're not centering them. They're not in the forefront. Jessica is certainly considering standards because she provided her thought process and the way she evaluates applications. I just think we haven't named those and put them in the forefront. And so since we are using them, I think we should just formally establish them and make sure they're in the forefront, both for transparency's sake, but also, again, to make sure that we're applying them fairly.
So would that be like, maybe at the top of the, the application restating like the equity lens that we're using and the NASW standards, and to kind of keep it at the forefront of our minds as we review?
Yeah, I think so. And just seeing if those, some of the NS or whatever was called standards may be appropriate and worth kind of adopting, but for some of the criteria, we may want to look to other references. I think that's some of the work the working group could do, is to look at what we're using now to evaluate, but also where appropriate, perhaps looking outside of those as well. But yeah, whatever we end up coming up with, I think at the beginning and kind of throughout the application, we should put those front and center so that agencies know, what we're looking for and how they can not only best position, really not even position themselves, but position the organization to kind of meet those standards or those expectations. And ultimately the goal is better outcomes overall for our community. So I think I don't want this to feel like it's something to make the process more difficult for agencies. I think what's in the front of my mind is, how do we lead to better outcomes for the people receiving services from the agencies? And if there's a way to do that by making some adjustments where appropriate, I'm willing to explore that.
Thank you.
Cheryl, Brian, I'm sorry, can I just jump in with a few clarifying points? First, let me say that I agree with the sentiment and the comments, but the Zoom grants application questions historically, and most importantly, the scoring questions didn't come from me or necessarily staff. They also were the mental health board, after each application cycle, would take a look at the application questions and the score questions and kind of approve them or tweak anything. And while it has been quite some time since the mental health board has done this, and I just wanted to say that it's always been a process that has been part of the public conversation, ideally. And that is another reason we're posting this information, or we have this information. And so I just want to say that, and also, should the committee decide to form a working group before the next meeting, I would be happy to offer support if if people wanted to meet in the building. I'm happy to schedule a room and be available to answer questions or provide additional information. And we also do have time. We can absolutely take the time to review this as a full committee, should the committee want to, for the May meeting. I think it might also be helpful to, it's at a later date, discuss priorities, but if this carries over into our May agenda, that's fine. That's fine.
Yeah, I think if there's no other volunteers, then what I can do is I can meet Jessica with you on my own. And I think would also be, and maybe what we can do is just meet with maybe we could, we don't, is the mental health board still established? That's what I thought. Okay. So maybe we can meet with, I don't know if there are members who served during that time that might want to participate in the working group. That might be helpful. I know I'm going to volunteer. I know Cindy is on the call, and Allie. I think they might be some really good partners to think through this as part of a working group. So I'm also happy to participate in a working group with members from the mental health task force or other members from agencies, someone who maybe served on the mental health board when these discussions of standards and other things came up, and then kind of take what we learned back to this committee at the next meeting, and we can continue the discussion there.
And depending on timing, I have a decent amount of experience with both case management and program evaluation and contractual adherence. So happy to, depending
Are
on
you
who
volun-
it is, happy to
Are you
participate as
volunteering?
well. If
We'd love to have you. I think
my only concern is that I am traveling quite a bit for work in the next few weeks, but so when I don't want to hold up the meeting, but if it works while I am in town, I would be happy.
and I said in person, but I think remote would be fine too.
Okay.
Right. I was just gonna suggest that's always an option as well to do virtual. I do want to be mindful of making sure we get input from people that are in the field, but also are mindful of potential conflict of asking input from our people that are part of organization that would potentially receive funding or apply for funding. So depending on the topic of what's being asked, yeah, we want to just keep that in mind.
I have to say, I want to echo that, because while I know that Cindy and Allie are on the call, the mental health task force does include many members who do receive city funds. And I think that could get problematic.
I thought we had agencies participate in our last working group. I know I was on another working group for this committee, and I thought we had them participate. Maybe it was about another topic. I can't remember, but
so if you don't mind me saying, we do have conversations with agencies, both that we fund and just other community stakeholders. And we've had roundtable discussions about community needs, mental health needs, referrals that agencies needed for participants but weren't able to find in the community. gaps in services. And we've been holding those conversations virtually since COVID really shut us down. And the pros are, because we're all able to meet virtually, we can meet more often. We can use tools like Jamboards and polls, through meetings. That's really helpful. And so it's absolutely appropriate and good and to involve community partners in that way. But when we are looking at the criteria and the measures that we will be holding agencies to that receive city funding, to have those agencies that apply for city funding sort of participate in that evaluation process could be challenging. I'm not sure. I would maybe want to run it by our legal department to see how we could have those discussions.
And Mrs. Sam or Samantha, I think part of it could also be just, you would have to include, you would have to really open it up to everybody as opposed to a small group. And then it can get complicated. Because if it's not open to everybody, then did those that participate have an unfair advantage? Which obviously is not the intent, but could it be argued? And it probably could be.
Yeah, I mean, I look back, I'm pretty sure we had a working group before and we talked about something related to evaluations. I know during the call I brought up like how, reporting what, different software people were using for reporting. And we were discussing things either related to evaluations or certainly very adjacent to it. I don't see it as a legal issue because ultimately they're not scoring and the applications, and ultimately the recommendations or the input will come back to this body to approve. So I don't think there'll be any legal conflict to it. But however we do it, I think I see a tremendous amount of value of having the people that have to apply participating in these type of discussions. But if that's not possible, I think, again, inviting people who develop some of the standards or criteria, the way we do this now to those sessions might be helpful. And hopefully a few of them aren't still connected to any agencies that we fund. So I'm happy to.
And I think,
Yeah, go ahead.
sorry, no, Councilmember Burns, I think I remember the meeting you're talking about, and it was very, very helpful. And I think how if I recall, I think we just invited, I think we just invited anybody who, like, it was almost like anybody who was interested in applying, like it might have been before the application was out. But it was a broad invitation, if I'm recalling that meeting.
Yeah, and that would be fine too. I only named Cindy and Ally because they're on the call with us today, but I think even a broad invitation would be fine.
And I think I will add that, well, I would definitely, depending on what's decided, we can run it by the legal department, and the city probably would want to do that. And it's just a question of the difference between getting input and getting insights on certain things, and the difference between having a select few helping in setting those standards. And those are two different things. We can do both. We can have people that are in the field and agencies and are working and have them provide input and insight without them being participating in how the committee decides what those standards would be or how we evaluate. Because even if they're not scoring, how you're going to decide to set your evaluation tool is going to greatly impact how scoring is going to land. And even if this, yes, there's different people that are going to score, but the way you're going to set it up, the questions you're going to ask, the categories, the number of, however it's set up, that's greatly going to influence where you land during application time. So I really do want to be mindful about that, but there's ways to do that, absolutely, and to include people from the community that are working in this field.
Yes. thank
Yeah, I agree with that. I only saw it as, I think the committee is gonna do that final work of determining how things are scored. I think we're on the same page. I think the value is just the input, and comments around certain things that we feel are appropriate. And then ultimately, we can come back to the full committee that'll determine what scoring and everything else looks like.
Perfect. Thank you, council member. Jessica, do you feel like you've got a good sense of next steps?
Do I have volunteers for that working committee? I heard Councilmember Burns mention that you'd like to meet with me. I would love to meet with you anytime you're free. But I don't know if we've officially.
Samantha, are you going to try
I
to participate?
I
We
can
can work
yeah.
around your schedule.
Yep, I can participate unless there's another. I was in the last one, so I do want to just, if there's somebody, mainly, I think Derek you're the only other count member that we haven't heard from, but if you would prefer, I'm free to give up my spot, but if not, I'm happy to make myself available.
No, Chair, I think I'm okay seeing the end product of it when it comes to the full committee. What I would also recommend too is we have several members that are absent tonight. I think probably 3 or 4. So I think maybe distilling the question of who wants to participate in this and what it looks like, and maybe sending that out in an email, Jessica, and seeing if there are other volunteers too.
That sounds great. And if there are no other volunteers, I will volunteer. All right, Jessica, we have another memo, right?
Yes, I appreciate the clarification. Thank you so much. I will once again share my screen.
And we can see it.
Can we see it?
Yes.
Oh, great. Okay. So our final agenda item under old and new business is the third-party ranking organizations. I did look into this. It was it was a really interesting suggestion. It was a great suggestion. Thank you, Vice Chair O'Connor. So the 4 largest are listed or outlined in the memo. Excuse me. I think I would love to get the committee's and thoughts about third-party ranking system and possibly discuss the pros and cons. The 2 most viable options, if we decide to go that route, would be Charity Navigator or Great Nonprofits. But really, I see sort of challenges with both that I outlined in the memo. Great Nonprofits really relies on, they're sort of like a marketing campaign. So agencies are given a certain window, and within that window, they look at, or the Great Nonprofits looks at the number of positive reviews that the agencies get, either from volunteers or people served or board members or staff. And it did not appear that there was a lot of concrete ways to evaluate organizations through Great Nonprofits. Charity Navigator, like Charity Watch and GuideStar, these are very geared toward funders or excuse me, donors and getting donors and funders. Charity Navigator has several has 4 criteria, and within those, of the agencies that were assessed, they weren't all assessed under sort of the same category, so there was that differentiation. And I think before we could use any, we would of course need to make sure that all of the agencies are able to sign up and be represented. So I'm open to feedback from the committee.
Cool. Vice Chair Ohanian.
Thank you, Chair. Yeah, it's Jessica with these. When I was thinking about this, it was, and I read through your memo. I think your summary of these organizations was helpful and highlighting key points here of what they're focused on. I don't think adopting any of these charities or these ranking organizations would be kind of what the final decision for granting agencies funding is rooted on. I think it's just a component. You know, if you think about how we assess agencies as a mosaic, this is one of the tiles. Depending on what the size of that tile is, we can determine here if it's a small piece or a large piece. But I think it is helpful to have a third-party assessment of organizations outside of what our biases might lead to us and whatever biases agencies might have about themselves when they're presenting their stories to us. And, you know, as sort of my involvement with and education, charter schools, and in a past life, I've always thought of Charity Navigator as being the one with the most integrity and the fullness of data that would be necessary for these types of questions, or just trying to understand nonprofits. So that's kind of where I lean.
This is Gerald's Fry, and I agree that I think in that summary, just a little bit of information. I like the way that Vice Chair Ohanian described it as a mosaic. It is just helpful information. I don't know that I would weigh it, you know, quite very heavily. But I just see it as almost just a helpful piece of information as we're ranking and making other decisions. I guess if we don't use it, I mean, there's nothing that says somebody couldn't go and look up these individual organizations anyway, but I do think it could be some more of that signaling. Yeah. So that's my perspective. And I agree on the Charity Navigator is the organization that seemed to be the one that fit the most.
I think my only concern would be is if agencies, I did read the memo, but I didn't notice anything about this, but my only concern would be if agencies had to pay to be reviewed or sort of be a part of it. I feel like that might be an undue burden on agencies who are already, you know.
Yeah, no, that's
Don't
fair.
have extra money, but that would, otherwise I could see it as part of the mosaic if it was something that was easily accessible to everyone.
I agree with that. Amanda, thank you. And Ken?
I would, I view this just like you view like the Better Business Bureau or others, you know, is that it is looking for something negative. If somebody got some bad rap because I don't know, their board was dipping into the money or something, but I don't see it as sort of a seal of, you know, a good housekeeping kind of seal on an organization. That would be my view of it. I think it might be good. I'm concerned about you know, making organizations as just as you were saying, Amanda, paid, get a sign off, from one of these rating agencies. But I could see if staff or somebody wanted to just run names through their database to see if there are any flags raised about questionable things that we might want to look at. But I think the review you're doing and the information you get, we get from all of the input that we get, including the staff's knowledge of what's going on in the organizations locally. I think that's to me is more valuable.
Jessica, do we know if they have to pay for a review?
I don't, but I'm taking notes, and
Okay,
so I would be happy to come back to the committee. Ken, something you said also reminded me that whenever the city provides federal funds up to a certain amount, we check agencies and contractors through the sam.gov site, and so that could be another way to
Oh.
see if, yeah. Do you have thoughts about sam.gov, Charles Fry?
No, I mean, I don't deal with it, but I'm familiar.
Okay, that's fair. So I guess what I'm trying to say is I appreciate the committee's thoughts. It sounds like we want to keep Charity Navigator in our tool bag as a mosaic tile. And so I can provide more information at the next meeting or at a later meeting about whether agencies would have to pay to participate. And if the agencies not represented by Charity Navigator would have the interest, capacity, ability to perhaps be included. And the committee, we can review it again as we get closer to analyzing applicants for the upcoming application cycle. How about that?
Perfect. Councilmember Burns?
Yeah, just so we're not currently using any of these rating organizations.
Correct, we are not.
And where did this come from? Was this at the request of a committee member, or why was this included in the packet?
So it was brought up at the last meeting.
Okay. Yeah, I think y'all, I hit it on the head. It seems like you said none provide program level information about outcome or finances. I think that's personally what I'm most interested in. And if any could do that, it might be interesting to take a look at. But do we know if there are agencies, third-party agencies that provide program level information about outcomes and finances?
No, so in my research for this memo, I did not find, these were the top 4, and I did not find any others.
Okay.
That really.
Okay. That's all, Chair. Thank you.
Thank you. All right. Anything else, Jessica, from this? I think we kind of get a good sense of it.
Yeah, no, I am set. Thank you.
The next item I have is additional public comment. Seeing none. I believe we have a motion to adjourn. And we don't need to vote on this. All right, well, thank you guys. We'll work on a working group. We'll see you in May. I hope you have time to enjoy this beautiful weather. And I think this weekend will be nice. So thank you all. Have a great day.
And be well.
Bye, everybody.
Thank you.
Bye, everybody.